Hi, I'm Carmel from OS First.
Oh, wonderful. Hi, how
Hi,
are
nice to meet you.
you? Thank you for helping.
Yeah, definitely. Thank you for having me.
Good. Perfect. Hey, Ricky.
Hi, how's it going? Sorry, I could not find that
It's
unmute
okay. I'm
button.
good. How are you doing?
Doing good. Ready to talk Hoka today. So,
Yeah, I think
yeah.
we're at 30 now.
Whoa, sick. That's awesome.
It'll be
That's
a
so
nice group.
yeah.
Yeah, yeah.
God.
Good.
Yeah. Thanks for putting this all together. I'm pretty
Well,
stoked.
thank you. Thank you for lighting the fire. All right, we'll just wait a couple more minutes. I feel like maybe some of you have more than one of you watching at a time if you're at the same clinic. Do you want to either show me your faces or just, I guess, reach out to me through chat? I don't want to forget anybody here. Oh, there we go. Wonderful. Hey, you guys. Well, thank you for joining us on our medical day 2021 via Zoom. And thank you to Hoka. I do want to say they kind of said, Carol, let's do something and at least get some education out there on their awesome products, as well as Superfeed and OS First. So I just want to say thank you very much for joining us. A little bit about me. I have been in the Run Specialty channel now for 20 years. I opened the store in 2004. So yeah, we're going on 17 years, which is exciting. And prior to that, my background was I went to Long Beach State and I majored in dietetics and became a registered dietitian. And like you, I did a lot of patient care. I worked in the hospital setting, private practice setting, and really loved what I did for those about 17 years. And then around year 2000, I thought, I really am enjoying my running, and maybe I could look into owning a running store. And the rest is history. And opened in 2004, and just trying to think here. Looking at the fit process back in 2004, we had a Brannock device where we would measure your foot, weighted and unweighted, and based on how much elongation we saw, flexibility of the arch, it would kind of guide us to what kind of shoe would be the most appropriate for you, possibly an insole. And we'd watch you run and walk, and that's kind of what we did. And I'm excited to say there's been a lot of technology change in our channel and in Fleet Feet in general. And we're going to show a little bit of that to you today, along with a little bit of product demonstration. So does that sound good? Perfect, perfect. I have you all on mute. What I'd like you to do is if you have questions, great, I see some questions already, just ask me, and at the end we'll answer all the questions for you, okay? All right, so let's get started. I'm gonna go to the front of the store and kind of show you some of the stuff we have going on now, and then we'll go on from there, okay? So here we go. And I thought I would show you that you can feel safe sending your patients to us. We all mask up around here. We want to stay open, be open, help people. So for those of you who haven't been here, this is my little store. We have about a 2,000 square foot space here. Apparel, accessories, and kind of our claim to fame is definitely our fit process, which is how we get our customers, your patients, and those in the community fit in the appropriate shoes, insoles, and such. So do you want to help me with this? We're going to make sure you can see everything while I talk.
Let's see. Yeah, but you can see all of them back. So it's I think that's just like having a picture of good place. Oh, yeah.
Yeah, just so we can hear you too. Because I don't think-
Yeah. Okay, so we're gonna we'll flip it around, but I kind of wanted to measure you.
Yeah, I can have.
I think they're not trail specific.
Yeah. Why don't
Yeah.
so I'll hold this while you go get Jamie can help
Okay,
us.
yeah.
Okay. So we have two different devices now that we've just launched. One was back in 2017, and this is our 3D scanner. And basically, we're going to go through a scan so you can see it. But how it works is you can see the little arms around the scanner itself. Those are small cameras that are going to take a picture of a person's foot. And it's going to show us not only length, width, but what the Achilles looks like, how high the arch is. It's going to show instep, so we know what volume shoe would be good for them. Do they need a wide, a narrow shoe, that sort of thing. So that gives us a static measurement. And then this is our new dynamic scanner. We partnered with Superfeet on this scanner, and it's pressure based. And basically we have the customer walk across the scanner, and then based on their gait, it will show us the movement of their foot. The exciting thing with this, both of these things, is it allows us to help our customer see their feet the way we see it. But also all this information, specifically the pressure plate here, we are now launching personalized insoles with Superfeet, which they'll get to in a minute. But yeah, it's all just super exciting stuff. So what we thought we would do is I'm going to have my marketing manager, Oliver. He's new, by the way. So those of you who have known a long time, you got to come in and meet him. But he's going to go through a fit with me. I'm going to fit him, and we'll kind of show you what it looks like. But then when you guys come in to get fit, we'll do it with you as well. Sound good? All right. Sounds good. I see some yeses. Okay.
So I'll have you hold it. It's the front facing camera.
Okay. Thank you. All right. So.
Yeah, you do that one-on-one good comparison point too.
For right now.
Okay. All right, so the next step is we have an iPad, and Oliver's going to step on our 3D scanner here.
You wait until you get older. It's like, are you freaking kidding me?
Where's my mom? Yeah.
Did you want to try your answers with them as well? To see how they go.
Stand still. All right, so it's analyzing his foot right now. So it takes about 15 seconds to get the scan done. And then what we'll have him do is come on over to the pressure plate. And again, this is a dynamic scan. So it's showing what his foot's doing in motion. So go ahead and keep walking back and forth a few times for me, Oliver. It didn't turn on, but you're gonna have to do it a few more times. Focus on your right foot down the middle. There you go. Right foot. probably one more time. Perfect. Wonderful. All right, so let me, thank you. I appreciate your help.
You're welcome.
Okay, so what I'm going to show you now is the information that will, I'll show you the sports bras. So if you have an active patient, you can send them to get a great sports bra. But we're going to share now what the scan will actually look like when the patient comes in.
Will you be here today?
I'll be here today, yeah.
Okay, cool.
So close.
Okay, perfect.
Yeah, yeah, I'll do that. Then, yeah, sounds great. Yeah, I'll make sure to put these on hold and.
Perfect.
Do I get a discount?
I will say I'm much better at fitting shoes and insoles than I am at Zoom, so bear with me here. Okay, so there we go. Perfect. So this is Oliver's foot, and we always like to kind of move it around so that they can kind of see what the shape of their foot looks like. And so the first thing we always start with is what the length of their foot is. And you can see Oliver's foot, his right foot's a little bit longer than his left, but anything less than a half of a size, we figure is pretty manageable with getting the same size shoe. Many of you know we typically will fit a half to a full size bigger than what our customer measures. Unless they're more in their golden years, sometimes we'll fit it a little bit smaller just so that they don't have a tripping hazard. You know what I'm thinking, Oliver? Why don't we go somewhere that's quieter since we have lots of customers in here? So the other thing you notice on his foot is it has, why don't you hold this and I'll hold that, it'll be easier for me. He has a little bit of a starting of, I'm not going to say a bunion per se, but definitely it looks like there's a little bit of calcification going on there. So we might point out that, you know, he's young, he's active, just to kind of be aware of that. The width of his foot, a D is medium for men. And so he's right in that medium level there. If you look at how he stands there, you all know this, you guys are much more educated than I am, but you can really see that this young man must have, I'm guessing, pretty decent high arches, right? Because you can see how that Achilles is kind of coming out. So my guess is that when I watch him run or walk in a pair of shoes, we're really going to see a lot of pressure a little bit more laterally on his foot. His instep typically will go hand in hand with arch height, and you can see his left instep's a little bit higher than his right, but it's right in that medium. So again, that kind of guides us to what kind of footwear would probably be the best for his foot. And then the last thing we typically look at will be heel width, because sometimes people who have a little bit narrower heel will get some slipping, and we might need to teach them some lacing techniques to kind of help them from slipping out of the shoe. So that's the foot scan. And then the next step is our dynamic scan. So this is showing every time he takes a step, and this is going to be a little bit slower through the Zoom, but you can still see it. So that dotted line, which is a little bit harder to see on the Zoom, but right down the center is if the foot were completely neutral and just went in a straight line, it's a dotted line. But on Oliver's scan, you can see how he really kind of rides the outside of his foot, and what we call the shadowing. He doesn't have a lot of shadowing in his arch, which to us indicates a very high arch, a more, not an overpronator in any way. I say an underpronator or a supinator. And we would probably go with the neutral shoe. And if he did want an insole, maybe a more dynamic insole would be what we would recommend for him. So exciting that you all get to do this as well when you come in, but we thought it would be neat for you to kind of see what the new technology is here in the store. So with that, I would like to introduce our Superfeet rep. And I apologize, my actual rep I work with was not able to be on the call today. And I have forgot, it's Brian, right? It is Brian, good, okay. Brian's gonna introduce a little bit of the products that he has, and then we'll go from there.
All right. Let me get my screen pulled up here. And boom. Okay, that was awesome. That was really cool run through of the fit process, and really kind of illustrates what's actually happening in store. So that was great. Obviously, my name's Brian. I represent Superfeet, and I really appreciate your time here to kind of listen in and learn a little bit more about our brand and about the products. I always, especially when I'm speaking to medical professionals, I always like to start with these two guys here. So, you know, we really like to harp on the fact that we're made by doctors for doctors. Okay, so these two guys, Dr. Chris Smith and Dennis Brown, they started Superfeet in 1977, originally as the sports medicine segment of the lab that they were working out of, which is Northwest Podiatric Lab, still functioning today, still making custom orthotics. But like I just mentioned, they were making prescribed, you know, devices for individuals all across the country. And in their time, in that decade leading up to 1977, they were realizing a lot of similarities in the products that they were making for people, a lot of similarities in their feet, and a lot of similarities in the issues that these people were experiencing. So it really became their mission to create a device that's a bit more accessible to everyone, accessible in this over-the-counter aspect, but also more accessible in the sense that it's a little bit cheaper, because as you all are well aware, custom orthotics do have the tendency to be quite expensive. And in those 40 plus years, we've come a long way, you know, and every bit as important as the innovations we've and milestones we've gone through with our products. I think the culture, you know, within the walls of Superfeet that they've cultivated is absolutely worth speaking to. But on this slide, I'm going to just kind of read through a couple bullet points. You know, we've got over 100 patents for our product. We're the #1 doctor recommended insole. We're the #1 brand worn by medical professionals, and we're distributed in over 35 countries worldwide. And really, all of this goes to say that I encourage you to have confidence when you recommend one of our products for one of your clients. You know, have confidence in the fact that we've been in this industry, you know, the longest, with over 40 plus years of experience, and we've really been proven to have the ability to provide a lot of help and a lot of support for people who decide to use our products. So let's dive a little deeper into that and discuss this, you know, idea of importance of comfort and how specifically at Superfeet we feel shape equals comfort. You know, there's a lot of really amazing raw materials that go into our products. But for us, the real innovation lies within the overall shape of the unit itself, and again, the benefits that shape has the potential to provide to people who decide to use it. So how does Superfeet work, right? And I love this image. If you are ever dealing with a client that is, you know, really struggling with foot pain or lower leg issues, yank out that sock liner out of their shoe that they came in with, you know, show them what that's all about. Oftentimes it's going to be a really flimsy, you know, piece of foam that doesn't have a whole lot of structure and definitely not a lot of support. And when you kind of set that sock liner next to one of our products, it really brings to light this idea of shape, right? And the benefits of that shape. So where we come in as a brand is we want to take that customer's 2-dimensional shoe and couple it with their 3-dimensional foot and kind of fill in some of those gaps, and to, you know, give that foot something to conform and adapt to inside the shoe, and to disperse some of those, you know, pressures that we're experiencing throughout the day, whether we're running, walking, or just, you know, hanging out on our feet all day in an office setting. So, you know, our foot has this really high level job and does it very efficiently, but most of us are living, working, playing, and exercising on really hard, flat surfaces. And we're not necessarily giving our foot a whole lot to conform and adapt to. So, you know, you can kind of bring this conversation to light if we think about this idea of the job of the foot. You know, let's say we were all hanging out and we went for a walk in the woods, right? anything that we step on or stand on, our foot is going to adapt and conform to that shape. You know, we come across some tree roots, pretty common. Our foot's going to conform to the shape of that tree, all while keeping us upright and maintaining balance and propelling us through our gait cycle. So again, really high level job. We've got to give it that job inside the shoe. And if we don't, oftentimes some of those little minor aches and pains, or even, you know, some bigger ones like plantar fasciitis can really come to light. So there's 3 keys to the Superfeet shape. We're sculpted for comfort and pain relief. We're naturally supportive, and we create a reinforcing or an energizing foundation. And the one thing I really like to focus on this slide is kind of something that's going to ring true for any product that bears the Superfeet logo, whether it's the Heritage line, the Run series, or this Me3D product that we'll eventually talk about here. But it's this idea of a really deep structured heel cup. And we do that for a reason, right? The idea here is we want to consolidate that soft tissue and that natural fascia underneath the calcaneus and utilize it as a natural cushioning system. Okay, so that's going to basically be how we're going to create that natural support. And then you've got this really kind of firm foundation that's going to help energize you and really promote movement throughout your gait cycle. But diving into product, you know, many of you are hopefully probably familiar with our Heritage line, and Heritage is basically our products that are named according to the color that they are, like Superfeet green, pretty easy one there. But I'd like to give you a little bit more information on some of the more running specific products, and specifically the products that actually bear that Fleet Feet name. So this is the Run Comfort series, and you know, we've got 3 options here. We've got the, you know, kind of the standard Run Comfort, a women's version of that Run Comfort product, and then a thin version. Okay, and really the thin product is a little bit more sleek and tapered down to help accommodate tighter fitting pieces of footwear, or more performance-based footwear. Price point remains the same on all these, it's $49.95, but what makes these running specific? And that conversation really kind of starts with this EvoLite stabilizer cap and that call out of EvoLite there. So on those Heritage items, that cap is going to be made of plastic, right? But when we're looking at anything in the kind of this Run Comfort line or anything that has that EvoLite call out, we've got a blend or a mixture of carbon composite as well as plastic. You know, and if you're familiar with carbon fiber in any way, it's being introduced into a lot of the footwear out there. But we've been using it since about 2013. And really for us, it gives a really resilient and, you know, re-energize, kind of that energizing foundation. But it's incredibly durable and lightweight as well. So we're able to pack a lot of support in this product in a really lightweight, streamlined package. Again, 3 product lines here, kind of that men's version, a women's specific line that's going to, you know, be designed to fit that female foot a little bit better. Oops. And then that thin product that's going to fit into tighter fitting pieces of footwear. And then last up in the kind of the Run series here that we'll talk about today is this Run Pain Relief. And it's important, right? And it bears, you know, kind of that pain relief title. So it definitely deserves its own slide here. Now, what makes this different from the other Run series products is really in that stabilizer cap as well as the foam we're using in the top sheet. So you see that EvoLite call out again. So we're using that blend of carbon composite and plastic to give you that really resilient, responsive experience. But what we've done here is we've really exaggerated the shape in that heel cup. Okay, and if you kind of hold that up next to one of the Run series, it's a little difficult to see in my camera, but the Run series has kind of a flat tapered base, and on these on the Pain Relief, it's a bit more rounded and exaggerated. That coupled with this therapeutic foam on top, which is a very thin layer of kind of a memory foam, those 2 items together work to maximize the foot's contour to this shape. And really kind of act to cradle that foot and to alleviate some of those aches and pains that they're experiencing throughout the day. So we just want to maximize the amount of foot that's actually touching that support. Price goes up to $59.95 on this one, and we kind of justify that with that therapeutic foam, and then we add a little independent heel stabilizer in the box as well to kind of prevent that sole from rocking back and forth. And then last up here, this one is a big one, and definitely one that we are incredibly proud to be working with Fleet Feet with to bring this to life and, you know, have a more personalized option in the store. And this is our Me3D product. And I'm going to keep this very, you know, kind of simple and streamlined, but with three main call outs here. The first being this idea of a custom arch support profile. And when I say that, this is a unique left and right experience, right? Before Superfeet, many years ago, I spent a lot of time on a fit bench, right? And it's very difficult to fit an individual that has two completely different feet, right? And a length discrepancy or an arch height discrepancy. And products that we pull off the wall are completely symmetrical, right? But their feet are not. So that issue is kind of no more with the introduction of this Me3D product. So we get, again, a very unique left and right experience. It's going to match and hug those arches exactly. The second call here is we're going to enhance that individual's natural motion with 5 zones of stiffness. And you can kind of see my little 5 zones called out with the white dots. And basically what's going on here is those zones are going to be thicker or thinner depending on what that dynamic scan determines is necessary for that individual, right? So thicker, where that foot needs to be a bit more cradled and supported, and then thinner in areas where that foot needs to be able to, kind of move and flow through its gait cycle a bit easier. And then last up, we've got directional flex lines. And the photo does not do it justice. I'm going to try and get close enough to the camera, but on the stabilizer cap here, you're going to get kind of this corduroy effect, right? And those are our directional flex lines. And essentially they're going to be, facing in 1 of 3 directions. You're either going to have a completely vertical heel to toe flex line, which is going to indicate a bit more of a neutral gait. You may see flex lines that are going to start on that medial heel and move towards that lateral toe. The idea here is we're going to promote more of, or increase the rate of supination and decrease that rate of pronation. So again, this is going to be something that you find for an individual that tends to pronate a bit more. And then the adverse of that is you'll see flex lines that start on that lateral heel and move towards the medial toe. So this is the exact opposite. This is, the idea here is to decrease the rate of supination and increase the rate of pronation. So designed for those folks that tend to roll on the outsides of their feet a bit more. Price point on this product is $149.95, and that's completely shipped to their doorstep. The actual stabilizer cap, once that customer goes through that amazing fit process at the store, they click buy, that information gets fed up to our headquarters up in Ferndale, Washington, and our multi-jet 3D printers go to work and they print off that stabilizer cap. And then we have an employee up there that adheres that top sheet, boxes it up and sends it out. So I encourage any questions that you may have about that, and please come head into the store to check out that process. It's really pretty amazing. And thank you very much.
Mm-hmm. Thank you, Brian. Perfect. So what we have next is Carmel with OS First. So why don't you go ahead?
Hi, everybody. I'm Carmel. I'm with OS First. I'm the West Coast Sales Manager based in San Diego. And what really makes our product incredibly unique is that it's all medical grade compression. And when you're dealing with blood flow and you're dealing with circulation, you better know what you're doing. That's all I can say. So really what we're famous for is our foot sleeve. And I'm using this model here because you can clearly see the 6 different zones. Medical grade compression simply means that the FDA is going to regulate the machinery that we use to make the compression socks and the compression sleeves. When it's graduated, we'll make sure that, for example, this is our foot sleeve with 6 zones of compression. And what we'll do is we'll make sure that the graduation is to create blood flow. So you wouldn't want a compression around the toe because then you wouldn't have the proper circulation. So we make sure that the levels of the different zones reflect the different levels of compression. We also, everything we do is going to be a wide bore heel. And I know you can't see it on the call, but there's a little tiny Y, and that is woven so that the heel is always cupped on the sleeves or any socks that we do. Now, the sleeves are going to have a 300 needle thread count, and our socks will have a 200 needle thread count. So all that means is that you're going to get a much higher quality medical grade foot sleeve. It's going to give when you walk, but then it's going to compress again when your foot is resting. And when Brian was talking about Super Feet, this would be, the socks that we have would be a great partner to the Super Feet insole. This is our wellness sock. The wellness sock has nano bamboo charcoal on the toe and the heel. And it's been proven that when charcoal is next to your skin, again, that creates circulation. Our wellness sock is fantastic for anyone who has neuropathy. And there's 5 different levels of neuropathy, from just slight tingling in your toes to someone who is diabetic that has lost almost all the feeling. And what's important about that is that you have a seamless sock, very, very light compression. The packaging will specifically say that it is diabetic safe. And then all of our socks are right, left specific. So obviously you'll have an R and you'll have an F. The sizes are on the inside top of the sock. Again, this sock, as I mentioned, has the Wygor heel, so it just cups your heel. And again, graduated, very light compression, silver infused, so it's antimicrobial. And this is our wellness sock. And the wellness sock we do in a no-show, and then we also do in a crew version. And this is the only sock that has the nano charcoal bamboo. Again, super, super light compression. One of our other items is the bunion sock. And I heard you mention bunion earlier, pointing out on the scan. And this is a really, really unique item because, again, it's seamless. BR4, bunion relief, 4 zones of compression. So this is going to be much lighter compression than the foot sleeve, which is treating severe plantar fasciitis. This is just going to be very, very light compression. The only place you're not going to have compression is where the bunion would be. And what you have here is a really nice soft terry pad. So that's going to protect the joint. Whenever you have a bunion, a lot of times you have that second toe that overlaps the first toe that overlaps the second, and that skin in between doesn't have any breathability. So what we do is, you can see here, we've put this seamless material in between the first and the second toe, so it really protects that skin. And again, it's important that this is seamless. And then I'm just going to turn it inside out really quick, and you can see this really soft terry pad that protects the joint. Again, the socks are just absolutely incredible. So everything we do is medical grade compression. And again, that means that the FDA goes in and they regulate the machines, so that if we say we have a 30 level of compression, then it's definitely that, it's going to be that level. We do a really great plantar fasciitis sock, and all of our packaging is very clear what the product is for. Bunion relief says bunion relief. Plantar fasciitis says plantar fasciitis. The plantar fasciitis sock is going to have less compression than the sleeve. This is for someone who is just recovering from plantar fasciitis. Maybe they're afraid they're going to get it, or they just want that really good feeling of support if they're going on a long walk, or if they're just, maybe it's someone who's just taking up running, or they're doing an alternate, run walk. This would be a fantastic sock for them, just to keep their foot from getting fatigued. Something else that we do as well, we do a thin air sock. This is very, very thin. This would be great for someone who wants very light compression. They want, maybe their foot they perspire a lot, so they want something that's really thin and breathable. Maybe you have a customer that has a very wide foot and you can't have a sock that takes up a lot of space in the shoe. The thin air sock is absolutely incredible. It's very thin on top, and you can actually see through, you can almost see through how thin it is, but the bottom is very padded. We've also added these two little puffy pieces right here are actually lift bars. So when this sock is on and you've got that compression, it's actually going to keep the airflow circulating. Again, right, left specific, silver infused, and then you can see here really that heel cup, it's the Wygor heel that keeps the heel fitting properly. Another really cool item that I think is just awesome, this is the DS6. So I've talked a lot about compression with the FS6. This is actually decompression. This is really, really incredible. So what it does is when you put it on, it's going to keep the fascia stretched. So this is something that you would want to wear at night. It's going to be an open toe. And when you put it on and you actually pull this on, you have these two little sticky tabs that will stick to the side of your foot. When you pull it on, you can just feel it stretching really, just really in a really good way, the fascia. This is not meant to be worn during the day. This is just a nighttime treatment. So where I've talked a lot about compression, this is actually decompression. So this is our decompression sleeve, only to be worn at night. And that's just a few of the top things that we make. I think the big takeaway is our wellness socks that help with neuropathy. And then we've got our plantar fasciitis sleeve with the 6 zones of compression. Again, medical grade, silver infused. And then we have our plantar fasciitis socks as well. A little bit less compression. And again, for someone who's afraid of getting plantar fasciitis or someone who's recovering from it. All of our socks are small through extra large, with the exception of the bunion sock. We just do small through large there. And again, all right and left specific. Something we just introduced, and it's become incredibly important, we're doing a wide sock. In the wellness sock, we've added a wide sock. So that's called the WP4+, the wellness sock in a wider width. And that is something brand new that we've just introduced.
Great.
Does anyone have any questions?
Why don't we get our questions at the end? Because
Okay.
one more, we have Ricky with Hoka next. Thank you, Carmel.
You're
I
welcome.
actually have my plantar fasciitis socks on right now. I don't have plantar
Okay,
fasciitis, but I'm just wearing them.
Yeah, I just wear it because they feel good.
And my Rincons, by the way, Ricky. So next up is Ricky Parra with Hoka.
Yeah, thanks, Carol, and thanks everyone. That was a lot of good information. I wear compression sleeves, specifically those ones for my posterior tib tendonitis issues I have. So nice, good compression around the ankle and green super feet. So loved learning a little bit more as to why I'm wearing them. But I'm going to share my screen here as well. So let me get my presentation up here shortly. And that out of the way. Perfect. All right, so I'm gonna get rolling. So yeah, so just as Carol said, my name is Ricky Parra, and I am the Northern California field rep with Hoka. Cool enough, I actually used to work at Fleet Feet Vacaville specifically with Carol, so her and I have a really strong relationship going way back. I was born and raised in Fairfield myself. And currently I'm actually residing in Fairfield, so nice to be local and kind of support the community and speak to the medical professionals of the Vacaville community with this. So I'm going to be kind of talking a little bit about Hoka, not just in the sense of footwear and product, but what I usually like to do is I do like to kind of go over briefly the backstory of Hoka, kind of how Hoka came to be, who thought coming up with shoes with so much cushion between the foot and the ground was a good idea, and why. Because with the brand that's only about still 10 years old, it's taken a lot of strides in evolving from what its initial purpose was for when it was first designed to kind of what it's kind of evolved into since then. So with that, I'm going to just dive right on in. And again, if there's any questions, by all means, feel free to toss them in the chat and we'll get to those bad boys at the end. So backstory of Hoka. I love this slide because it kind of just plainly says exactly kind of how Hoka came to be. Hoka One One's roots are in the mountains. So who kind of thought of Hoka? What was the reasoning behind it? So it was created by two Frenchmen named Nico and Jean-Luc, who are two Frenchmen who actually used to live in the French Alps. And they were, as you could imagine, for people living in this mountainous terrain, they were huge adrenaline junkies, not just purely trail runners or mountain runners. They were doing anything imaginable that you could do on a mountain, skiing, mountain biking, rock climbing, what have you. And what they were finding when they were kind of comparing all these different experiences in these sports to each other, they were finding a bit of a difference in experience on the downhill experience. So for example, if we looked at skiing or mountain biking, typically when you're going downhill, it's of course a huge adrenaline rush. There's a lot of momentum being built, but if of course there's any point where you need to reduce the momentum, slow down, there's some sort of braking mechanism or braking technique that allows the individual to do so without creating too much shock or impact on the body. So they looked at that and then they kind of compared that to the running downhill experience. And that's where they kind of noticed the difference. When an individual is running downhill, typically our only braking mechanism is altering our biomechanics in a way to where we maybe start to lean back a little bit more. We start to heel strike a little bit more aggressively just as our braking technique. And that can create a lot of extra shock and impact on the body. And so with that in mind, they essentially wanted to address the downhill running experience, specifically for a lot of ultra marathoners out there for long periods of time, hours on end in the mountains. And so what they did is they started creating these prototypes of Hoka. They started packing out different dimensions, different midsoles and foams, and kind of just playing with different shapes. And ultimately what they came up with a shoe was a shoe with this max cushion concept where when they took it out to test, they found that they were running certain routes they had run in previous footwear faster, but also able to go for a lot longer periods of time without feeling as fatigued as quickly. So once they saw those results, that's when they felt it was about time to go to market with it, which was around 2009, 2010. And that is the backstory of Hoka. So again, it initially started as wanting to address the downhill running experience. The cool thing though is with that, despite that being the initial reasoning, it's since evolved in a dramatic way where it's not just focused around the ultra marathoner. We've seen these last 10 years, it evolved to now be able to accommodate various individuals for various different pursuits, whether it's just trying to get off the couch and start walking, start running, to, of course, people maybe in the gym or such as your patients who are getting referred to for any injuries or ailments that they may be experiencing. So really just kind of going from this initial purpose to, again, evolving into being able to accommodate all these different facets of individuals. So with that, I do like to go over briefly what we call the Hoka experience. So this is essentially what an individual can expect when they're wearing a pair of Hokas. There are three major components that make a Hoka, with the fourth being specific to our stability line, which I'll touch on here shortly. But first and foremost, the first major component that makes a Hoka is pretty straightforward. It is our signature cushioned midsole. So along kind of to complement that backstory, ultimately the purpose of the cushioning does a really good job of reducing the amount of stress and impact on the body, so the individual can feel like they can do their activity for a lot longer periods of time without feeling as fatigued as quickly. And so from there we jump to the second component that we call the active foot frame, or we like to describe it as the bucket seat. So as the image shows here, the cool thing with Hoka that sometimes people don't know when they first look at a Hoka is while it does look like there's a lot of foam to it, you're actually not standing on top of all of the foam that you see. You're actually cradled within that footbed where you have a frame surrounding the entirety of the foot. And so that's where I like to say it does do a good job of providing some form of inherent stability. So if you have individuals who maybe aren't completely overpronating, maybe like one foot slightly overpronating while the other foot's fairly neutral, these do a good job to accommodate that. But then it also does a good job at complementing Superfeet as well. I'll plug Superfeet as well here. I do use green Superfeet myself. So again, with that cradling, it does just a great job in complementing that. And then jumping to the MetaRocker, from a lot of medical professionals that I've been able to speak with in the past, this tends to be one of, if not the main reason Hoka gets referred to many patients. Because with the MetaRocker, what it's allowing the foot to do, as opposed to traditional footwear, where it sometimes tends to be a little bit more of a flatter surface, the MetaRocker in Hoka's tends to cause the shoe to have a little bit more of a curvature to it. And so as opposed to having to flex the foot too much, where maybe you're creating a little bit of extra stress and tension on the feet, on the ligaments, on the tendons, it allows your foot to kind of just relax in that footbed and just kind of more so roll through your gait cycle. So really rock through that gait cycle. We like to describe it as like a tire from a mountain bike. So it also does a really good job of kind of creating that continuous momentum, almost like, again, that wheel that's constantly turning. So again, that tends to be one of the major reasons why Hoka gets referred to, is due to our MetaRocker and it allowing that foot to just relax in that footbed and not have to flex so much through your gait cycle. And then finally, J-frame. J-frame is what we call our stability technology. And we call it that because, as you can see through the image again, it is in the shape of a J. And what we wanted to do when we approached stability for the first time, I believe it was about 3 or 4 years ago, is we wanted to try and do something a little bit different from what a lot of traditional stability shoes had been doing essentially since the 80s, when stability was first presented in the running space. We didn't want to disparage that concept, again, just wanted to do something different. And so what we did is we wanted to be able to guide the foot through the entirety of the gait cycle, from the second the individual lands to the second they toe off. So that's why, as opposed to just focusing to that in that one medial portion of the shoe, as most traditional stability shoes do, we extend a little bit of that denser foam from the heel all the way through to the forefoot for toe off. But we also wrap it around to the lateral side of the shoe as well, just because what we were finding is, again, in more traditional stability shoes that just solely relied on that medial posting, typically towards the end of a shoe's life, because that medial posting is denser than the lateral side of the shoe, you can possibly start to lead toward that outward tilt. And that, as we know, just any slight sudden change of biomechanics can ultimately lead down the road to injury, or it's more susceptible for injury down the road. So that's the Hoka experience in a nutshell. And so from there, what I'm going to do is, I did also want to put this slide in here. So we actually do our part to actually work with medical professionals and make sure we are kind of getting these stamps of approval. So we actually do have a seal of acceptance from the American Podiatric Medical Association, and all these styles here do have this seal of acceptance, and I'll be touching on a few of them here shortly. But I believe majority of these styles are available at Fleet Feet Vacaville as well, including the flip-flops and the slides down below, which have a good amount of arch support and still, again, have that Hoka cushioning and that cradling of the foot. So just a fun little slide there. And then I'm going to just touch on two key styles that are more often than not likely going to be the styles that your patients go home with when you're referring them to Vacaville. And these also tend to be our most popular because of typically the referrals that you are sending your patients to the Fleet Feet. And first up is going to be the Bondi. So the Bondi is what we call our max cushion shoe for Hoka. You're not going to get more cushion than this from any of our shoes in the road lineup. The way I like to describe the Bondi is, if you can picture for a second, imagine yourself laying in bed at night, and when your body hits the mattress, the Bondi really is equivalent to that experience with the mattress. And I say that because when we hear max cushion, sometimes a lot of people think, oh, it's going to be wicked soft and you're just going to sink right on into that shoe. And that's kind of a yes and no to the Bondi. So if you imagine yourself laying in bed at night and your body hits the mattress, yes, it's max cushion or it's a thicker foam mattress, but you're also more than likely not sinking all the way down, hitting the box spring underneath. There's a little bit more structure to that mattress to kind of support your body. That's the experience that a patient can expect with the Bondi. The Bondi also tends to have a little bit of a broader base and a wider platform to accommodate a little bit more of a voluminous foot. It also has a non-slip black leather option, which is down in the bottom corner here as well. That was something that we had been getting asked for quite a bit from multiple people, and so we finally made one. And so that's the Bondi 7. The other thing to note here is I called out available in wides. This is available in a men's 2E and 4E and a women's D width. So just bear that in mind. And we do use true wide widths. And so what I mean by that is we do actually create shoes that are true wides, as opposed to some brands out there that sometimes they don't add any more material to the foam as a regular width. They just add more material on their uppers. That doesn't always do a great job in providing enough support for someone who truly needs a true wide. So with that, Clifton 7, similar to the Bondi, great cushion, but I would describe this shoe as a pillow. So again, imagining laying in bed at night and your head hits the pillow, that is where you can expect your head to sink right on into that pillow. Super soft, super plush, super cushy. That's the experience that a patient can expect here with the Clifton. It has a little bit more of a slimmer fit to it. It's not narrow by any means, but just by comparison to the Bondi, it does have a little bit more of a slimmer fit to it. And it also is available in wides, not a 4E for men, but it is available in 2E and a D for women as well. So those two styles that I just showed you are two of our neutral styles that are very popular. And then lastly is the new Arahi 5. So the Arahi 5 is one of two of our stability shoes. And I would describe this shoe as the Clifton 7 for stability. So it's very similar in its experience underfoot, where it's that pillow-like sensation. It just has that J-frame technology around it. And the cool thing with our J-frame in the Arahi specifically is we try to do it where it's not an intrusive amount of stability. Sometimes you get different levels of stability where different levels of stability where some are lower stability, some are higher ends of stability. This just is going to do a really good job of accommodating various different needs in the space of stability. And so just wanted to call that out here because this actually just updated this month. And so Fleet Feet will have it in their doors as well. And again, all these do a really great job at accommodating super feet as well, again, because of that footbed with that active foot frame and all that fun stuff. So again, all that paired with good compression sleeves for patients who are dealing with injuries like those are nice. So that is it for me. I'm going to stop sharing my screen.
Awesome. Thank you, Ricky.
Yeah.
So I don't see any questions. Any questions? No questions. Well, that's good. That means we explained it.
I have a question. My name's, oh, here's my camera. I don't know if you can see me, but my name is Judith. I'm at Vallejo Kaiser Physical Therapy. And I just had a few questions. I don't know if Superfeet, the socks and Hoka have any kind of chart that they could send us with the different, you know, types of Superfeet and the different types of socks and the different Hoka shoes and what they're recommended for, because that was a lot of information. I wasn't able to write it down quick enough. That would be super helpful. And then with the Superfeet, I think I missed with the more custom one that was $149. I didn't quite understand how that is ordered.
Yeah. So as far as that process, so the fit process that we went through in store there virtually, once that's completed, so once we've got that information from the static scan as well as the dynamic scan, it consolidates all that information.
So where's the dynamic stand and the static stand? That's what I didn't catch.
Oh, okay. So That's where we come in, the store. So that's how we will help your patients is if they come in, we do those scans for them.
I see. Thank you. Okay.
Yes.
Yeah. I was trying to figure out where those scans were done.
And just so I don't forget, because this
Yeah.
leads right into it. So many of you have these and many of you don't. These are actual referral pads to send people to my store. And they can be as simple as just go see Fleet Feet and buy, you know, Hoka, Superfeet, OS First, whatever you think your patient needs. Or you can be a little bit more customized to it. Like I want a cushion shoe, a custom insole. You can definitely fill out as much as you want. And I don't think down in Vallejo, Kaiser, that you guys have these. So I'll make sure to get some down there. Okay.
Yeah. I don't believe we have those. Yeah. That
Okay.
would be helpful.
And did you have another question?
Yeah, I would be interested also in getting the names and contacts of the vendors, just so that if I had a question about, you know, for this particular problem, what do you recommend? That may be helpful. That may be something you know as well. But that the contacts would also be helpful in addition to the information on the different products.
Yeah. And
then
oh, yeah.
I had another question. We actually at Vallejo have a very old set of Superfeet that is missing some different sizes, because it's always helpful just for the patient to get a little sense of like, oh, okay, yeah, this feels a lot better, then they're more likely to go pursue it. So I didn't know if that was something that you guys were thinking about as well.
Yes. So I'll answer that, Brian. So we can get you a ring and of all the current product. And I don't know if you guys have Me 3Ds yet on that ring, Brian, but that might be helpful so they could have what the personalized looks like. And then in terms of product, I mean, I've been in this industry for 20 plus years now. I feel like I know a lot and I teach that to my staff. And typically what happens is if we don't have an answer, we will get it for you. But the one thing I do pride my staff in is being a local business. We spend 3 months training them on product, biomechanics, how to fit. And if I'm not here or my manager or my employee that's been here 11 plus years, they will reach out to us if something is a question out there. So I'll talk to the reps whether they want to have a direct access. The reality is these 3 individuals aren't my direct people I will deal with. So it might make more sense to have somebody that's right within my territory. So Ricky's moving on to some other great things coming up here, and the other 2 are just helping us out today. But you have my email. So my email, for those that don't have it, it's carol@fleetfeetvacaville.com. What I'd like all of you to do is send me an email of the time you sat in on this. And then what we're going to do is respond to that email with a personalized gift for you to come in and get fit and get those products that we had promised. So again, it's carol@fleetfeetvacaville.com. Any other questions? We do have another one starting in a couple minutes. So if you have questions that you think of after now, feel free to email me or call the store and ask for me, and we'll definitely be in touch. Great. Thank you.